This is the largest meta-analysis ever done on how much anxiety and stress-related disorders raise the risk of dying and of attempting suicide. The motivation is simple. Anxiety is the most prevalent mental disorder in the world, over 300 million people. Yet, unlike schizophrenia or depression, the evidence on mortality has been contradictory. This paper sets out to settle it. Two design choices matter. First, only full diagnoses are included. Studies that relied on symptom questionnaire are excluded to reduce inconsistencies. Second, they compared patients not just against the general population, but against people matched on comorbidities. The findings: more death across the board. All-cause mortality was about 54% higher, driven mainly by generalized anxiety disorder and PTSD. But suicide is where the effects are large. Suicide mortality was nearly threefold and elevated across every subtype. Suicide attempts were higher still, peaking at a six-fold risk in panic disorder. Crucially, these suicide findings showed no publication bias, so we can trust them. There was also elevated cardiovascular and natural cause mortality, pointing to a neglected physical health burden. The caveat: when they matched patients to controls on comorbid illness, the all-cause signal disappeared for most subtypes except generalized anxiety and panic disorder, which stayed significant. So the honest reading is, the excess mortality is real, but for several disorders, it's largely mediated by comorbidities rather than fully independent. The suicide signal, though, held up. Practical implications. First, anxiety disorders are currently not included in major clinical suicide risk tools. Given a threefold suicide risk, that's worth changing. Second, the cardiovascular signal means these patients need better general medical care. The backdrop: only 1 in 4 people with anxiety gets adequate treatment. A large, treatable population with a measurable mortality gap. That's the public health case.